Well, in every patient that we receive in our clinics, we need to estimate global cardiovascular risk. And by doing so, we will be able to identify those patients in whom we have to be more strict in the control of global cardiovascular risk. And I refer to the need to control all the different cardiovascular risk factors that could contribute to promote and enhance velocity of progression of atherosclerosis, and finally to increase the possibilities of having an atherothrombotic event or even die as a consequence of cardiovascular disease. The question then is, how do we estimate global cardiovascular risk? And nowadays we see that the possibilities to do it correctly are increasing continuously. So we have the classical concept of cardiovascular risk, which increases mostly 6 cardiovascular risk factors, and this comes from the Framingham risk score. But to this, nowadays we have the concept of metabolic syndrome, which is added, to this classical concept of cardiovascular risk. Very frequently both are associated. So in my experience in the hypertensive population, a relevant percentage present an increased global cardiovascular risk if we consider the classical way to estimate it, and at the same time they present metabolic syndrome, so the risk is further increased as a consequence of the finding of this metabolic syndrome. So in the future, what we will need to do is to know exactly which are the factors to be considered. And from now on, albeit guidelines don't tell us how to consider this metabolic syndrome, I personally think that the finding of this metabolic syndrome is very important. And if I find a patient with this, I know that I have to do something else than what I did, simply by considering classical cardiovascular risk.